Hi everyone, this is Dr. Kim, America's Holistic Foot Doctor. In this video, you meet my patient who has developed a deep-seated corn on the tip of a toe. This happened because the toe was bent down like this, we call it a hammer toe, and it also caused the nails to be thickened as well. Let's see how I can help him. So he doesn't have a corn here, but so we're gonna cut down this nail and then we're gonna clean out this whole area. But as you can see, the toe is a little bit pointing down, so he's walking on the tip of the toe instead of the bottom of the toe where the cushion is. So that's why he's developing these. So, glad this is not painful, huh, John?
Not yet.
Not yet, I know, it could be. It could be painful when it turns into a corn. So we have to kind of keep it down so that doesn't happen, you know?
Okay.
But usually you're a pretty tough guy. You don't feel much pain anyways, right?
Oh, I feel pain.
Oh, you feel pain?
I think I feel more now that I get older.
Oh, is that right?
Yeah.
Oh. You're a pretty calm guy. You don't look like you feel a lot of pain, but I guess we all feel pain. But sometimes these things are not painful, but it can turn into a very painful situation. And then sometimes I see a corn developing underneath it, and that's when it becomes super painful. So I have to kind of keep these calluses down because if it constantly irritating the area, then it can turn it into a corn. It feels very hard, as you can see. It's like a rock there. So I have to be very careful getting rid of this callus because it could be painful. You had this for a while, right, John?
Yeah.
Yeah, I've been working on this for a while, but
You said something about a procedure to correct that. Is that still?
yes, it's viable, but I mean, you don't have a lot of pain, so I mean,
Oh, okay.
yeah, if you were having a lot of pain, then we would consider
Okay.
doing what we call a hammer toe surgery, where we would straighten out the toe, where you're not going to be walking on the tip of the toes anymore, and then this will just go away on its own. But we would only do that if you have a lot of pain, because surgery itself is painful, you know. So I don't want to give you pain when you don't have pain, right? So
That's fair. That's
yes,
good.
yeah. So if you come with pain, then I may have to give you some pain to get rid of the pain. But that's kind of my surgical philosophy. A lot of people come and say, "Oh, it doesn't look good. Can you get rid of it?" I said, "Well, is it painful?" I said, "No." I said, "Well, then we have to think about it some more because."
Okay. That sounds like a good plan.
Yeah, because you're not going to be happy when you didn't have pain and all of a sudden you have pain, right, with the surgery. So
Yeah.
we try not to do it unless you have a lot of pain. Hi, it's me again. Hope you've been enjoying this video so far. If you have, leave the word hammer toe corn in the comments below, and don't forget to hit that subscribe button. Looks like a rock here, so I'm kind of peeling it a little bit at a time here because it could be very, very painful. So we got down pretty good now. I don't see any corn in here. As you can see, this is very difficult to cut this out because it's very hard. It's like a rock down here. So I have to kind of slowly tease it off. Oh, you may have a little bit of corn there, but you don't have pain. So corn looks like that. As you can see, you see a little bit of darkness in there, like a round circle. That could be.
Is that what's causing the nail to raise up?
Yeah, so it kind of feeding each other, you know, the nail's thick and then it pushes it down and then these calluses start moving up and irritating the nail. You may have a little corn here, as you can see, a little bit different, but you don't have pain, so I'm not gonna give you pain. So now we can cut the nail a little bit more because I just couldn't get to it earlier. So cut the nail a little bit more and then I'm gonna grind all this down really well, and that should take care of it. The nail's pretty hard too, so I think we got the callus or the corn pretty well. So we're just gonna grind it nicely, and then that should do the job. Yeah, this is a very common problem because a lot of people, especially when you get older, you have a lot of hammer toe problems because your feet are not that stable anymore. So your toes are grabbing the ground and started like pointing downward. And then it's because of all the pressure, it can stick in the nail, and then it forms a callus here, and then kind of feed each other, you know, with nail problem, and then the callus problem, and then they're all kind of together. So it's a very common thing that I see, and then our goal is to keep the nail down as well as the callus, because you don't want the callus to turn into a corn, which becomes very painful, and then we have to burn that corn to eliminate that, or sometimes need the surgery to straighten out the toe, because that's, you know, it's kind of difficult that to treat this problem because it's going to keep coming back. So yeah, so that's what we're doing, John.
Okay.
Yeah, as you can see, we got that down with just a little sharp point right there, so we're going to smooth that one down. So that's pretty flat, and then yeah, there's a little corn in here, but he doesn't have pain, so we're not going to be too aggressive with it. We just want to keep it down so that it doesn't create any painful corn underneath this callus. So yeah, so that's pretty good. That's pretty smooth up on top, and then it's pretty smooth over here. So that's kind of where we are. So as you can see, we got that one down. As you can see, there's a little corn underneath it, but he's not in pain, so we're not going to create problem for him. Okay. All right, John, thanks for allowing us to film you today.
Okay.
Thank you for watching this video. As you can see in this video, hammer toe deformity on the tip of the toe can cause a corn and a thickened nail. This needs to be trimmed down often because this can develop into a very painful situation. Until then, be educated, get empowered, encourage others today.